Ready when you are, sir.
Good morning, all. I want to compliment you for not replying to my email. You did very, very well. And, if you don't show up, I'm not going to come chasing you. So please don't let me know that you're coming. Anyhow, we are about to start session 3 of our How It Works programs. And number 1, does everybody know how to silence their telephone? Because if you don't, everybody is going to look at you and say, why didn't you do that? So please do everybody a favor and either turn the phone off or put it on silence. It will be greatly appreciated. Okay, I guess we're ready to go. Miss Michelle, are you ready?
I am.
Okay, come on down.
I just need to put on my glasses really fast. All right, greetings, everyone. How are you? Thank you for your grace when we tried to do this last semester and then realized we were going to have to cut it way too short and wanted to be able to do it in the full 6 classes. So, welcome to How It Works, Part 3. Let me give you a little background on how we decided to do this class. So we had such positive results and feedback that I had received through Chuck, and he thought it would be nice, after our restructure last spring, almost a year ago, it'd be nice to do kind of an overview about what Community Matters is. And yes, you're going to get a piece of that today, but I thought it would be helpful for you to see how the Community Matters team, in conjunction with the Health Services team, work together behind the scenes for your benefit. So everything you're going to hear over the next 6 weeks is how they all are working together under kind of the holistic approach of the 8 dimensions of wellness. That sound like a plan? Okay. So let me show you a little bit. Oh, wrong way. This way. Here are your presenters today. I just get to kick it off, and really the other 2 are going to carry the bulk of this. But a little bit about this. So the next 6 weeks, you're going to hear about Community Matters. You're going to hear from our Spiritual Life team and our Health Services team. So this was the class description. Over 6 weeks, you will engage with campus leaders to uncover how these areas support emotional, physical, social, and spiritual well-being, fostering a deeper understanding of what it means to live well in community. Now, what I have asked the team members to do is to talk about not only their roles, but also all those behind-the-scenes meetings. When you call them and they don't answer their phone and they're saying, I'm in a meeting, it's because they're probably talking about one of you in a good way, in a way to support you. And so I wanted you to kind of see the behind-the-scenes work, and I've also asked them to highlight all the committees that they might influence, that they might work with if they're liaisons, and how they get new programming from hearing directly from you. All right. And here is your class schedule. So after today is kind of just setting the stage, and then their next 5 classes will be Move, Play, and Thrive. So you're going to hear from recreational therapy, you're going to hear from fitness, and you're going to hear from life enrichment. And then changing needs and steady support. In that class, you're going to hear about the transition of care model. So when you are starting to experience a health need, whether you're going to transition through the community or bring services into your home, you'll hear about how we go about that. Nourishing the inner self, that is going to be Spiritual Life, and you'll hear directly from Peggy. And then Together Through It, that's going to be a session on mental health and all the support programs we provide there. And then the last one is Partners in Your Health, and Nina will be holding that one, and you'll hear from our various medical providers and why and who we bring to the campus for your benefit. All right, I always like to start with our mission, vision, and values, because all the decisions we make get filtered through this. So just as a refresher, our mission: inspiring purpose and vibrancies in life's journey. Live brightly, age boldly. Our vision: to foster an innovative community where people meet purpose and aging is transformed. And then our core values of compassion, accountability, respect, and excellence. We ask the team members and even the board of directors when we're making big decisions or starting new programming, the thing we're gonna do, does it fit within this? So we always ask that to be filtered, decisions to be filtered through that. All right, how many of you have heard of the 8 dimensions of wellness? Most of you in the room, good. So let's just talk a little bit about this. So here are our 8 dimensions of wellness: emotional, financial, physical, occupational, social, intellectual, environmental, and spiritual. So that the classes, the next 5 weeks, are all going to be talking about these various pieces. And you take a look at those, you can think about some of the programming we do that fits within these. When we talk about emotional support, we have mental health support programs, financial. When we have DESNY bring in understanding Medicaid or financial planning, we try to support there. Physical, how many of you take part in our fitness programs? I know there was a class just recently, right before this class going on. Occupational, this one, the team sometimes talks about, do we need that within a retirement community because it talks about work? But all of you have a deeper passion. Some of that might still be your work. And so we want to make sure we have that. We also look at this one for our staff members. So a lot of the things we do for our team members are built around these 8 dimensions of wellness. We have social. And how many of you went to your Christmas party for your buildings, right? We do a lot of social fun around. How many of you go to happy hour and hear the singers, right? Lots of you. Intellectual, this class, lifelong learning. We want to make sure we're tackling that. And environmental, so good health by occupying pleasant, stimulating environments that support well-being. And then spiritual, and you'll hear directly from Peggy. But when we talk about this, each one of these items don't stand on their own. It takes an entire team to help do this. And so while this is not the full organizational chart, we're trying to simplify it for you. You see that some of my direct reports are Peggy, Donna, and Cheryl, but under Donna, it has a lot of the operational pieces of this. And our very first How It Works class was all on the operations side. We really, again, wanted to focus this on the holistic approach to care that we give. So we're asking Nina and John, both from their representative areas, to talk about how they work together on this. So now let me turn it over to Nina, and she'll walk you through her team members, and then she'll turn it over to John.
Can use this or the screen? I just have one. Yeah, I just have one. Yeah. Good morning. Right. It's been a busy day so far. Thank you all so much. So a little bit about my area. Again, I oversee all the healthcare components, the licensed environments and programs on campus. Here you will see our team. We have our assisted living environment. That includes our early memory support, or Virginia Piper right here. We also have our healthcare environment, our long-term care. We have our outpatient environment that is located right to the right of me. And then we also have Beatitudes at Home. So each of these areas, as well as our programs, are led by our beautiful leaders across campus. We have an assisted living manager, we have a director of nursing, we have our director of therapy, and we also have our director of Beatitudes at Home. And all together, we work in a collaborative way with Community Matters and other entities on campus to provide care and support and resources to all of you. So while we go through the sessions that Michelle has already announced early on this slide, we will do that deeper dive in that behind the scenes of what that actually looks like and what does that actually mean. Because we are truly an ecosystem and we can't do it alone. We actually work very well together, and you have a voice in that, which is most critical in any collaboration, is who are we talking about and what support do they need? And it's very individualized and intentional. And so we work very well together. I'm gonna just invite John up here so he can review his team members and what to look forward to.
Thank you very much, Nina. Before I get into the Community Matters team, I was thinking about wellness, just that word this morning, and I kind of wrote some down to me that impacts me. So wellness is not the absence of illness, disease, stress, right? We all have that throughout our day. So we're not thinking of that wellness dimensions as, we're checking these off, so we're not gonna have disease, we're no stress, nothing like that. But what wellness is, it's the presence of purpose in our lives, active involvement in satisfying work and play, joyful relationships, healthy body and living environments, and happiness. So that kind of framed it for me when I was kind of thinking of wellness this morning. So, as Michelle alluded to, back last spring, we kind of repurposed what the community resident services and independent kind of looked like into what now is Community Matters. So I'm the director of that department. So what that encompasses is life enrichment. So we have specialists, not only in our independent living side, but in all of the neighborhoods in our healthcare center and also in Plaza View. And we work really close together to make sure programming really does hit on those dimensions of wellness wherever you're at across the campus. So no matter where you're moving through the continuum in the life enrichment side, we want it to really kind of have the same feel as you're going through. And community support, resident services was rebranded to community support, which involves Molly Hayden, who's a rec therapist, and Mara Gilmartin, who really supports the admin side, as well as works one-on-one with a lot of you. You have a lot of communication with Mara, which is amazing. Resource navigator, we kind of brought that role over to Community Matters, which Des is in that role now, which can help with questions for financial stuff you may have. What does it look like moving through the continuum here at Beatitude? She's really there to support that. We brought in a full-time technology concierge who can help with your personal type technology questions you have, can help with building confidence using technology, and work closely with our IT synergy side of things. Jennifer Long in media and printing, all those Roadrunners, Roadrunner Extras, Beeper, Flyers. Jennifer really has a huge portion of that. And then fitness, we have Mike and Carol, who you'll see, of course, leading all those fitness classes, putting on some presentations, and all of that good stuff for you there. And don't worry, as Michelle said, next week you'll get a lot more detail from this team next week.
You are staying with me, John. Do not go away. Yes. Okay. So I'm going to work off of two tablets, one in front of me and my personal. So just in case you're seeing me, I'm not conquering the world. I'm trying to make sure my presentation goes well. So how do our teams work together? As we already shared, that we have regular meetings. Michelle said, if you're calling for us and where are they? They're never at their desk. It's likely because we are in a meeting discussing what support or care one or some of you guys need at that particular time. We house over 600 residents on this campus. You guys are very busy. We want a vibrant community, and it takes a lot of hard work to do so. And so we have regular meetings, and with one of the sessions, especially the one with Desney and the healthcare team, we're going to talk about what those meetings are, what we discuss, so you can get that behind-the-scenes look on how things actually happen and how conclusions or support actually come to fruition for a lot of you guys. There's shared communication.
Yeah, absolutely. So, of course, those meetings are amazing to have, but we then, the team members who are at those meetings, make sure we're sharing those with other teams that they're coming back with. What we want is to make sure we all have that understanding of what is coming out of those meetings. We are not a heavy meeting company, I don't think. We really try to have our meetings be important, so we're not wasting each other's time, as well as being there for you when we have those meetings. And what comes out of those meetings, we want to make sure it's shared throughout all of the team members on campus.
Very true. So there's plenty of platforms that we use for communication to ensure that as information is provided, we share it so we all stay on the same page, to include our residents and sometimes our family members. Coordinated planning. I have to say, we're 26 acres.
26?
We are a large community. And so to coordinate with the different bodies that are scattered throughout the community, sometimes it's challenging. And so one of our sessions, actually probably several of them, we would talk about what does that actually look like and what does it take to stay in communication and collaboration for the benefit of all, right? Not only for the residents, but for the team members so we can work efficiently and effectively out there for you. Anything you want to add?
I agree with all of that, Nina. That was great.
Oh, okay, so all of our communications is intentional, and the problem solving, we problem solve together, and we anticipate the needs and respond quickly when changes occur, and changes occur all the time. So what does this mean for you?
Yeah, absolutely. So this means, so we're all collaborating together, right? So earlier support for you all. If we're all communicating clearly with each other, understanding what is coming out of that communication, we can react and make sure that support that is needed for our community, we can provide to you all.
Yeah, I would tell you that we're not perfect all the time, right? Because we're human and human things happen. And so when we are talking and we're able to connect earlier and provide that clear guidance, and as we continue to do that, we offer that continuity. So when it all works together, residents experience fewer handoffs, and some of us can probably provide a testimony to that because of the clearer communication and the support that evolves as we change. So as things happen to you or to your friends, we have to pivot as well, and we're constantly doing that every day. Anything to add to this slide?
Perfect, Nina. For the slide, I'm sorry.
Yeah.
So for the continuity of time, right? That is important. Now, programming or things may change, but our philosophies that we're going into creating those programmings or care, we want it to stay the same as we're discussing those things within the team. So what we want is that communication and philosophy that we're talking about stays throughout the entire campus. And that is a really important thing for you all. So you know when you're going into wherever you may be on campus, you know the outcome of what was decided was discussed as a team and collaboratively as we move along.
So no single team owns wellness. As shared, we all contribute. Each dimension of wellness is supported through different roles and services, but always with collaboration and shared responsibility. Do you have anything? So one community, one integrated wellness team. We are going to, in our sessions, talk about the transition of care and support. What does that look like with Destiny? How does that communication happen? How do those handoffs happen? How does the support and the resources how are they delivered? These are the things that we are going to do that deep dive, and hopefully you can come out understanding a little bit more about how we work together in that aspect. Coordinating care across the ecosystem. I'm going to tell you guys, my new phrase right now, you always have a term that you use, you pick up, and then you start using it. Ecosystem is mine right now. So you may hear this quite a few times in the next month or two. But coordinating care across the ecosystem, because we're all integrated together, right? And we're all thriving because of the way that we communicate, the intentional collaboration and carry through the system. And so we're going to talk a little bit more about that with one of our systems. Quality and accountability. So all this works only if we are checking to make sure that we are providing the top quality of care and support to each and every single one of you. And again, that looks different for every situation, for every resident. So what does that look like? And accountability, making sure that we are doing it well and that we don't have gaps or outcomes that are not desired as we provide you that support and resources. And so that one, when we start talking about that, I think a lot of you guys will be fascinated about what data, information do we gather to determine, are we providing excellent care, quality resources and support, education to our residents, to our team, and how is that accountability pushed out?
I was just going to add with the accountability portion of it, as we're Community Matters Health Services teams meet, right? We're meeting on a regular basis for that accountability for each of us to make sure we're following through on what was discussed within those meetings. So that accountability portion of it, I mean, it's one of our core values with our campus. So it's an important piece of us to follow through on that accountability, and those regular meetings and relationships that we build is important for that.
And then team collaboration, again, the core of this is collaboration, communication. So we have meetings such as our health services team meetings as weekly. We have nutrition at risk. And again, you're gonna see these meetings kind of fall under the 8 dimensions, right? We have risk and retention. Where are our residents who are needing additional support? How can we best support them so they can continue to thrive here on campus? We have Comfort Matters. You guys are very much aware of that. That is our dementia program. And how do we support people who have trouble thinking? What does that look like individually, right? And how does Beatitudes ensure that this program is alive and well on the floors and where we care most for our residents and throughout the campus? We have our quality assurance performance improvement. Again, this is the quality and accountability. How can I ensure the quality is where it needs to be? And there's always opportunity for performance improvement. But in order to have all of that, we have to look at who we are, who we're serving, and pull that data and information and discuss and then build plans to ensure that we keep our quality of care right up here. Some of you guys know and are on the Health and Wellness Committee. So your voice, we've alluded to this already. The critical piece of all of this is your voice and what you need. And so a lot of our marching orders comes from the different platforms across the campus where we meet with residents through committees or whatever group to determine what else is needed on campus to support you best. We have the Beatitudes Senior Care Motion that has been alive for probably now 2 years on campus, where we are intentional about bringing the right providers on campus that also are willing to collaborate and work together intentionally for the benefit of you.
Yeah, and then the program development, that's a big team, cross-team way to go, right? Our life enrichment team can set up those programs as well as try to get you interested in those. Now, over in our license building, right, our health services team provide that support for the individual that they're able to get to those types of programmings, whether it's a health support, maybe a little extra support at that actual programming. You know, a lot of those, our team over there, our CNAs and caregivers are physically at the program that our life enrichment team is doing to help provide support for us, for the individuals there. So that's a very real collaborative effort that I think goes a little unrecognized from Nina's team as well as our team on how much they do work together in those licensed areas.
They do. Yeah. They do. An additional program development is, Nina, what kind of support do the staff get educationally? Right? Because a lot of our staff members are licensed and they are required to have continuing education. How many nurses do I have in this building? Yep. So we have a lot of nurses. You know that it's so important for that continued education, but our residents need continued education as well. We talked about, one of the dimensions is it's occupational, right? And we will associate that with work, but we can also associate that with purpose. Right? And we are actively, a lot of us still have a desire to be purposeful. So how do we support you in that aspect? And that is bringing program development, education on campus, and opportunities for you to thrive here in that area as well. And then the introduction of partners. I mean, so many between the different departments where we are bringing partners onto campus. I mean, we talked about bringing the American Heart Association back on campus. We have
fiduciaries coming on campus for y'all for the educational piece, financial piece. Yeah, those partners, our team members do a lot of hard work to develop those relationships with those partners to make sure what we're providing for you is top of the line. So a lot of the stuff in the background from our team members are reaching out to those partners, asking them, what's your kind of philosophy on things to make sure it can connect with Beatitudes when they come here for you.
And so many more. And again, this is part of what we're going to be presenting together in some of the sessions that will be shared in this session. So, questions. Do you have any questions for us?
As people are thinking through questions. So today was designed just to be very high level, so we can let the other team members and the two of them kind of dig into each one. This was the best way we could organize this. So if you don't have a burning question, I did see one hand, I'll make sure someone gets to you. Also be thinking about the various classes that I went through. What's something that you have this burning desire to learn? Because our teams can make sure they work that in too.
Do we have an employee benefit that encourages them to get more training to improve their skills?
Oh, yeah. That's something that I am personally very excited for Beatitudes and what we do here. Not only do we have a scholarship mechanism for our team members across the board, if you're in dietary to healthcare environments, assisted living, we encourage that growth, and we actually have a lot of our partners out in the community, Carrington University, Crichton University, Grand Canyon University. We have students on our campus throughout the year doing their clinical rotation, and we encourage our own team members to continue their education if they desire to do so. And then that scholarship mechanism or platform that we provide our residents through the support of Beatitudes, they are allowed to take advantage of to apply to their tuition or needs in that school program. And it could be any type of program. It doesn't have to be clinical in nature. It could be anything that they want to do, we will support them with. So yes, great question.
Yeah, and even in our operational budget, we budget out for education for team members to have throughout the year to make sure their skills are continuing to grow and they can grow with Beatitudes here long term.
Any other questions?
You just mentioned the employee benefit of being able to apply for a scholarship. Do they do this on their own time, or are their work schedules arranged to accommodate a class schedule, for example?
Yes, we offer the ability and support our team members when they go to school the best that we can. So it has to be reasonable, right? So for example, I'm so proud to announce several of our two of our team members in the healthcare center. They work 12-hour shifts, and they were going through nursing school. So they were nurses, LPNs, and they desired to become RNs, registered nurses. They went to school. We shifted their schedule so they can be very successful with their school schedule as well. And they just recently graduated as RNs and have committed to continuing working here at Beatitudes because of the level of support that we provide them, not only through the scholarship program, but also for the ability to go to school successfully while working here. Yes, and so kind of what John kind of shared, that we also offer that's outside of university or tech school type environments is internal continued education opportunity. So we have Comfort Matters, which currently today is not only, let me just start with, Arizona has passed a law for all team members that work in and around assisted living to have dementia care training. But Beatitudes has always been the forerunner in that area because we've always had Comfort Matters as a dementia training for our team members. So our team members currently get 8 hours of dementia training and 4 hours annually. So 8 hours initially and then 4 hours annually on top of other types of training that we are required to have, infection control, you name it, we are having on our campus, and we're going to share a little bit more about what does that actually look like, because I believe you'll be surprised to hear the type of education that we provide our team members so their skills remain sharp and they provide the great care for you all. Was that? Okay.
Thank you. What mechanism do you use to determine customer satisfaction?
I'm so sorry, surveys. Yes, we use resident surveys, as well as we use our grievance compliments form feedback internally. So we have used that. I don't believe we've pushed out a resident survey in a little bit, but you will start to see the surveys come back out. I could tell you that we are introducing some platforms that will provide the ease of pushing out surveys to you so we can get immediate feedback. We don't want to inundate you with surveys because there is a thing called survey fatigue, and we really want you to provide quality feedback back to us so we can not only close that loop when we have a response, but actually see that response fully implemented onto the campus. And so more to come on that, but just because we haven't pushed out a formal survey does not mean that we have not received feedback from residents in different platforms on campus, such as resident meetings that we have throughout the campus. So we do collect feedback, but it hasn't been a formal survey, but that will come soon. Did I answer your question okay? Okay.
Yeah, I would just add the resident council. Can I switch with you, Nina? Oh, fair enough. So the residence council committees that we have, I believe there's 11 or 12 of them. You know, there's a team member liaison for all of those, and we get quite a lot of feedback throughout those. And then those can be brought to our team members to support those or get them out on there. I think also when you see the weekly Roadrunner events as well as the monthly calendars, that's your all's voice, right? We're getting that from you all in regards to the life enrichment and programming, educational stuff. That's your all's voices that we're trying our best to get those out for you. So it's a different way to think of the calendar, weekly stuff. Like that's your guys' voices in regards to that stuff.
What other questions? Does anybody have any, as you think about the sessions that we are going to share, there's still time to give us some feedback on what you would like to hear at one of the sessions. So any thoughts regarding Nina, John, we would love to know a little bit more about how you do XYZ. Okay, we just want to make sure we cover what you want to hear in our sessions to come. Okay, all right.
All right, thank
Hand
you
it over to
guys. So just as a reminder, and the classes will be longer the next 5. Next week is Move, Play, and Thrive. So you'll hear from life enrichment, rec therapy, as well as fitness. And 11:30 in this room. See you then. Thank you guys for the kickoff, and I think you're going to really enjoy the programming. Thank you guys.
Okay, just before we go, I will be sending out copies of the slides after each session, and so look for those in your email. We have a perfect group of email addresses for this class. Everybody's email address is correct. I did have one get kicked back because the dummy who was entering the stuff in lifelong learning didn't spell Gmail correctly. But that sort of stuff happens. But anyway, it's all corrected, so everybody's email address is correct, so you will be seeing a copy of slides coming through shortly. Thank you very much for attending, and have a great day.